One of the cruelest ways for a doctor to generate income illegally must surely be to inform the patient he has cancer when the patient is cancer-free, and then charge the patient for medical services that were never required. In July 2015, Dr. Farid Fatah was sentenced to 45 years in prison. Federal prosecutors called him the most egregious fraudster in the history of this country. Patients were not people, they were profit centers. The breadth of Fatah's misdeeds was laid bare in a sentencing memo from prosecutors, who revealed for the first time that a total of 553 people allegedly got unnecessary treatment, amounting to 9,000 injections or infusions that cost insurance companies and patients millions of US dollars. The Detroit doctor, a hematologist oncologist by training, pleaded guilty to 13 counts of Medicare fraud, 1 count of conspiracy to pay or receive kickbacks, and 2 counts of money laundering. He would tell patients that they had some form of cancer, such as multiple myeloma or myelodysplastic syndrome, MDS, and then treat them for the disease, often for years. Many of these patients, over 550 of them, had no cancer, and Dr. Fatah's motive was money, which accrued to him over the term of the treatment period. Quite a lot of money was involved, as Fatah forfeited almost 18 million US dollars that he had billed to Medicare and various private insurance companies. The patients' stories were heart-rending. Often the treatment involved a painful course of chemotherapy, causing hair and teeth to fall out. One patient, a Canary, related how he was treated for testicular cancer from 2000 to 2013. He underwent 40 days of expensive and harsh chemotherapy, which was more than necessary for the condition, and dozens of other treatments and procedures, including 2 weeks of hydration therapy. He had a testicle removed, which was a totally unnecessary procedure. Many patients testified the medical bills just kept piling up. They were financially ruined by tests and treatments that Dr. Fatah insisted were necessary. The patients persisted with the regimen because they feared the alternative was death. Please hit the subscribe button if you want to learn more about the myths and corruption surrounding medicine. It's the little image of a Neanderthal on the bottom right of your screen. Also, please indicate whether you like or dislike the video.